Uh, Currently there is some. I think there seems to be some surge, but it's a bit controlled, I think. Yeah. Okay. On behalf of Professor Dongsu Lee, I'd like to introduce today's lecturer of today's session, Professor Trong Khoa. Dr. Khoa is currently senior lecturer at Hanoi Medical University and chairman of Oncology and Nuclear Medicine Council in Bach Mai Hospital. He's vice president of Vietnamese Society of Radiology and Nuclear Medicine. Dr. Khoa has accumulated outstanding achievements in the research in nuclear medicine oncology. So he also delivered us a lecture regarding thyroid cancer previously. Today, Dr. Khoa will deliver us the lecture regarding nuclear medicine cancer imaging. And so please welcome Dr. Trong Khoa.
Yes, good morning, everyone. Yes, today I am very happy to see all of you again. Yeah. Now, can I start my presentation?
Yes, please.
Yeah. Dear oncologists, today I will share with you some information about nuclear medicine cancer imaging. The nuclear medicine measure has a primary vision with diagnostic nuclear medicine and
I think the sound is not coming. Dr. Khoa, the sound, I think it's not hearing. So could you check the video?
First of all, we share some information about nuclear medicine imaging equipment.
Yeah, if you turn off your mic, I think the sound is not.
Now we have had hybrid imaging.
Dr. Khoa, I think if you mute.
Now we have back and right. Frequency,
Dr. Khoa, can you hear me?
the difference between the two types capacity, whole body capacity and total body capacity. And this is the image of whole body PET-CT being used very widely today. And now this is the picture of the total body PET-CT. You can see here, and it is a new generation PET-CT machine that were invented in the very recent time. We can easily see the difference in structure between these two type of PET-CT machine. Which is the length and to wide width of the detector of PET machine. You can see here very different. Yeah. And this comparison image clearly shows the difference between the two detector of the two PET CT. You can see here. Yeah, the whole body PET has a detector length of less than 30 minutes, 30 centimeter. Why total body PET has a detector length of up to near 2 meters. It's just enough for the length of the portion with the rated height and wide, and with a high degree of accuracy, and that detector width is close to 80 centimeter. And because of because length of the detector in whole body PET-CT machine is less than 13 centimeter, so we have to take many times to take each PET, and then have to combine many body segments to create a whole body image. So it takes us about 30 minutes to scan a patient. Meanwhile, total body PET-CT, you can see here, yeah, has a detector nearly 2 meters long, and so the time to take a full body scan from the head to toe only need one PET, and it is only take about 30 seconds per patient. You can see here. And since we obtain with the total body PET-CT we give the physiological function feature, and give a detailed high resolution anatomical image at the time of capture, as shown below here. And this is a total body dynamic image. In just one bed with the total body PET-CT. You can see very clear there. And with total body PET-CT, we can take very low radiation dose compared to whole body PET-CT scan, but still achieve high resolution even with very small tumor size. Consider the total body PET-CT system have a very short scanning time. It's only take about 15 seconds to have a full body image, so it is comfortable for the patient and very suitable for the children. And it is to realize the advantage of the total body PET-CT, such as firstly, that is application to many clinical fields such as oncology, cardiology, neurology,
pharmacokinetic research. And secondly, can imaging with a very low radiation dose. So it is suitable for the children and young people as normal people. As a third, can imaging with the high speed, very short time, but with very high resolution, good image quality. And this slide shows more clearly what we just did. Now we will look at some indication for the tumor imaging using several nuclear medicine techniques, such as specificity, PET, PET-CT, PET-MRI. This is about some indication for the tumor imaging by nuclear medicine technique, in which an important indication is a simulation of radiation therapy blended by PET-CT. And it's easy to see that the PET-CT has the higher value in the clinical indication for the cancer. Yeah. And now here we see the value of specificity in oncology. The first is for the breast cancer. Spectrum technique can achieve sensitivity and sensitivity up to 80% and specificity about 77% when we scan with the 99M technology sensitivity. And one result of our study shows that spectrum scintigraphy with 99M technology MIBI can detect primary tumor in nearly 70% of breast cancer patient, and detect axillary lymph node and another position and at low rate. And this is a spectrum image with 99M technology MIBI that can help detect lesion in the right breast and lymph node and brain metastasis, you can see here. And what is the value of specificity for the lung cancer? Another study shows that specificity for the diagnosing metastatic lymph node is lung cancer with 99M technology sensitivity has higher specificity than CT only. You can see here. So one of the study also shows that the spectrum scintigraphy of lung cancer with the 99M technology MIBI can detect the primary tumor with a high rate more than 70%. We can easily see the primary tumor is the right lung when scan with the spike. Yeah, you can see here. We also easily recognize metastatic lesion of lymph nodes, brain, and bone from the lungs, from the lung, also spike image. You can see here. Yeah, very clear. We will see the roles of specificity in the liver cancer. One of our studies shows that the liver scintigraphy with 99M technology sulfur colloid can help in detect one or more lesion site. You can see here. Yeah. And this is the image of liver scan with sulfur colloid labeled 99 technicity. Yeah, you can see here. And this is scintigraphy image hepatic hemangioma scintigraphy with labels erythrocyte. You can see here, very clear. Yeah. And now we see the roles of spasticity in brain tumor. One hour study shows that the spasticity scan with the 99M technique can detect one or more brain tumor lesion. And we can easily recognize the brain tumor on the spectrum. You can see here. Yeah. And spasticity have a great role in detecting metastatic bone lesion is cancer. Many types of cancer can be detected on the 99M malignancy label MDP scan as shown in this table. You can see here. And this is a case of the prostate cancer with the bone metastasis with the multiple lesion on the bone scintigraphy. And this is the case of colorectal cancer with bone metastasis, but on the CT was negative, but the bone scintigraphy was positive. You can see here. We cannot see anything in the CT image, but just scintigraphy by best spec you can see here. Yeah, positive. Now we will see the roles of spasticity in the thyroid cancer. This is a scan of the patient with papillary thyroid cancer who was treated with IV-131 but has, now you can see here, has two lung metastasis on the spike scan. You can see here. And this is the case was thyroid tissue was completely destroyed after 6 months of treatment with IV-131. You can see here. Yeah, very clear. And this is the case of the thyroid cancer with lung metastasis. On CT, it is negative, but SPECT scan shows metastasis in both lung. Now we will talk something about the clinical roles of opacity in oncology. And this is cyclotron and opacity, and yeah, you can see better. And this table shows us just many radiopharmaceutical I use in passive and PET imaging based on the mechanism of tumor transformation and metabolism. And there are many applications of opacity in oncology, including the application of opacity to simulation radiation therapy planning. And we can indicate the opacity for many types of cancer. Yeah, you can see here. First of all, we would like to share some information about the roles of opacity in the diagnosis and primary tumor. And get help to diagnose primary tumor with sensitivity about 80% in one stage and specificity of over 80%. 90% significantly higher than CT. You can see here. And the results of our study shows that opacity has high value diagnosis in primary lung cancer with concordance rate between opacity with histopathology reaching about 97% and with very low from positive and negative rate. Yeah, you can see here. And you can easily detect small primary tumor in patient with lung cancer on PET-CT. You can see here. Yeah. And PET-CT help to distinguish lung cancer and on the latest synthesis very clearly why on sensitive words cannot distinguish this. You can see here. You cannot see everything, but the CT is very clear. Yeah, and the same image you can see here. PET-CT make it easier to detect metastasis, lymph node, and primary tumor. Why the CT alone cannot detect them? You can see. And PET-CT also help to distinguish between the pancreatitis and pancreatic cancer. You can see it. Yeah. While on the CT, yeah, it is significantly difficult to distinguish this lesion, but there is a CT image, PET-CT. You can see very clear. And now we share some information about the application of PET-CT for the head for the diagnosis cancer recurrence and metastasis. One study shows that PET-CT has higher than sensitivity, specificity, and accuracy than CT in detecting lymph node metastasis. Here, yeah, this is the values of CT and PET alone and PET combined CT. You can see here. And PET-CT can detect recurrence and metastasis with the high sensitivity and specificity for many different types of cancer. And PET-CT is very valuable in recurrence monitoring, recurrence and metastasis after treatment. You can see here. Yeah, you can. Yeah, and we can easily see other PET-CT images of lung cancer patient with lymph node metastasis and which you can see here. Yeah. And for the colorectal cancer, the PET-CT can also detect recurrence and metastasis with sensitivity of over 90%. Yeah, and this is an image of colorectal cancer with elevated CEA concentration, but the CT was negative. We can easy detection of many metastatic lymph nodes in the abdomen of PET-CT scan. You can see here. Yeah. And we can detect bone metastasis after treatment in patient with prostate cancer by PET-CT. Yeah, you can see. We use combined levels float 918 with FC8. Yeah, and we can compare in the AEF with the floating in 18. Yeah, you can see here. Yeah. And capacity has a very high positive rate for the poor differentiated carcinoma. You can see here. Yeah. This is a best FDG best value. And to compare with I will want you on the whole body scintigraphy. You can see here very low. Yeah. And PET has high sensitivity and specificity than thyroglobulin concentration. Yeah, you can see here. And PET also easier detect the recurrence and lymph node after treatment. Wise whole body scintigraphy with I negative but positive in PET-CT FDG. You can see here. Yeah. And for breast cancer, PET has a much higher sensitivity and specificity than mammography. Yes, mammography as well as CT and MRI. It's detecting primary tumor and metastatic lesion. You can see here. Yeah. And this is a PET-CT image of a patient with recurrent metastatic breast cancer after treatment with many metastatic lymph nodes. You can see here. Yeah. And for pelvic cancer, we have much higher sensitivity and specificity between the two different radiopharmaceutical. You can see here. Yeah. Yeah. And PET-CT has also an important role in the predicting and responding to treatment. Many studies show that if the patient has a PET-CT, even have performed PET-CT, it will be helped to make a decision about the right treatment or the change the treatment method and predict the outcome and respond to treatment. One of our studies shows that after doing PET-CT, the state of the disease changed by about 80%, and just help to change the treatment in the right direction. This is a patient with lung cancer who underwent PET-CT to assess and monitor response to treatment. Very good treatment results. You can see here complete response after 6 cycles of chemotherapy combined with radiation therapy. You can see here. Very clear. And most of this patient has a good response to treatment. A complete response after having PET-CT. Second, to evaluate before and after the treatment. You can see the before and after the tumor was destroyed. And this patient, you can see is the before and after treatment. Yeah, you can see in the good result with the complete response after the treatment. And this is the case of the relapse after chemotherapy and presented many metastatic lymph nodes detected by PET-CT. You can see here. And the before the treatment and after, and so after that recurrent, you can see here. And PET-CT has helped to follow up after radiation therapy is very well. Yeah. Yes, this after chemotherapy, before and after chemotherapy. Yeah. And what about the opacity in biopsy guide? Yes, the opacity has a high value in accurately determining the lesion area. So it will help biopsy accurately reduce the number of the time need to be re-biopsy and surgical cost. You can see here, so under the guidance opacity, we can easily insert the right biopsy needle into the area with the highest concentration of opacity of FPG. So the biopsy result really more accurate than if we using CT only. You can see. And in this question, you can see also the CT image. It is very difficult to detect vision. But on the PET and PET-CT, it is very easy to see and to look at the biopsy side. You can see here. And PET-CT has another very important role is the radiation therapy planning simulation. In Vietnam, we have a routine use of PET-CT simulation. Yeah. A simulation with PET-CT will help solve the radiation therapy planning difficulties. We often encounter when using PET-CT to simulate the radiation therapy planning, as shown in this slide, you can see here. And this PET-CT machine with the simulation function. And this slide we face a lot of difficulties in some cases. Right here, when simulation with the CT radiation planning, radiation therapy planning. Yeah. Yeah, you can see here. Yeah. On CT, we cannot distinguish the tumor and this lack of tissue. You can see very difficult to see here. But on PET-CT, you can see here, they are very easy to identify tumor. Yeah. And collapse the lungs. You can see. This is the same you can see here. We can easily detect lymph node metastasis or distinguish the tumor and autolectosis to help the simulation radiation therapy correctly. You can see here. Yeah. And this is the process of blending radiation therapy with PET-CT in our hospital. Yeah. And PET-CT simulation has all the values CT simulation, but have a new value that is the BTV. It means biological tumor volume. You can see here. This BTV is the value. Yeah. Yeah, you can see here. We can easily determine the BTV value and detect metastatic lymph node to have a appropriate treatment plan. Yeah. And the treatment results are very good, and the tumor and the lymph nodes are wrong. You can see here the before the treatment and after you get good results. The treatment and you can see here's the same situation. Yes, yeah. As you can see here's the PET-CT situation. Very easy to see is a PET-CT. Yeah, for the simulation. As this patient responded completely to the treatment and the tumor was destroyed. You can see the before the treatment and after treatment, you cannot see the tumor, the lesion. Yeah. And you can see here the before the treatment and the after. Yeah, yeah. Yes, it's the same. Yeah. The before this tumor before the treatment and after, we cannot see everything. It's a passive image. Yes, the same. The before and after. Yeah. Basically, the patient has a response completely. And what about the opacity in theranostic? You can see here, yeah. And then in this slide, you can see this is a opacity image to help detect small metastasis. Is a patient with prostate cancer and help to evaluate the effectiveness of the treatment with very clear image. You can see here that before the treatment and after the treatment, the good results is the same, because it's before as after the treatment. Yeah, you can see on the passive image. And you can see here, yes, it's the same as patient here with prostate cancer. You can see here, yeah, before and after the treatment. Yeah. And now we would like to share some information about the clinical roles of PET MRIs in oncology. And this is the image of two kind of PET MRIs being used in the clinical practice. You can see here there's a batch image and MRI image in profusion of PET MRI. And this is a primary brain tumor on the PET MRI, and the lung cancer. And this case is where it is very difficult to detect the lesion on the PET alone or MRI alone. But the lesion are very easily seen on the PET MRI image. You can see here, and it's very clearly the tumor is the prostate cancer, yeah, patient. And we would like to share some information about the radioimmunoscintigraphy immunotherapy. We can use a technique by we have to use radio levels monoclonal antibody to bind and to the condition of the cancer to be researched. Yeah, you can see this is monoclonal antibody and this radionuclide. You can see here. Yeah. And the same, yeah. This antibody, and you can see here, since this radio levels monoclonal antibody with sufficient poly bind to a corresponding antigen on the surface of the tumor cell. You can see here. And you can see here that it is a high precision imaging techniques at the molecular and cellular level. You can see here the PET imaging images are very clear. You can see we can use the, for example, you can use one monoclonal antibody, trastuzumab, was labeled with dopage. This dopage was labeled gallium 68. You can see here. The image is very clear. Yeah. And we have recent specific scintigraphy to diagnose the disease very accurately. Here. First of all, we can use the gallium 68 proton test for the perform the PET-CT in the diagnosis of pancreatic neuroendocrine tumor. You can see here. Yeah. Yes, you can see here. This is the PET-CT image of the patient with modular race. That's thyroid cancer image with octreal receptor. You can see here. Yeah. And this is the PET-CT image to evaluate the effectiveness of the treatment of neuroendocrine tumor with the PRRT. Yeah, you can see here. Yeah. Before and after the treatment. Well, thank you very much for your attention. Dear own colleagues, today I will be sharing with you some information about nuclear medicine cancer imaging. The nuclear medicine measure has a primarily vision with us diagnostic nuclear medicine and therapeutic nuclear medicine, and to perform.
Thank you. Thank you, Professor Carr. I think, yeah, very broad subject with very comprehensive review of all cancer imaging using nuclear medicine. So do any participants have questions or comments or what? Okay, so do you do often the tumor imaging for breast cancer? So what are the clinical needs? So what are some indications for tumor technetium DB imaging for breast cancer in your hospital?
Yes, and thank you very much for your question. Yes, in fact, in our center, we perform the spike for breast cancer with technicity 99 ml every day, so because in our center we have spike capacity and PET-CT, and so almost the patient has the patient with breast cancer. We the first we ask patient will be performed by spike or spike-CT, and if we have any not clear, and we have some information. Some information we have to discuss here, and suspicion and so on. So we need education for by PET-CT. Yeah.
So then compared to, so do your hospital also are doing the breast sonography or mammography? So what are some difference, or is there, are those patients doing all the exams like mammo, sonography, and also the breast BB imaging? Are they doing all the imaging studies, or?
Yes, yes, the ultrasound and mammography we perform every day for screening test, screening for all women, and but if as the first we almost the woman have to perform the ultrasound or mammography, if we have any reason and we have some suspicion, and we when we perform specificity and so on.
And thank you. And you have shown us imaging for lung cancer and mediastinal lymph node metastasis. So compared to the PET-CT, is there some preference, or do you usually do the DV imaging for the lung cancers?
Yeah. In fact, we have that's the spike and specificity have low sensitivity to combat the PET-CT is finding lymph nodes and mediastinal lymph node and so on. But in fact, we have to use specific CTs for all patients with lung cancer. But when we have suspicion and we have information from the specificity not clear, we perform the PET-CT for patient. Yeah.
Thank you very much. And I think there was someone had a question, maybe Dr. Kogi. I think someone raised up a hand. Do you have any, or other from the participants, do you have any questions or comments? Okay, I think thank you for your very comprehensive lecture regarding all the tumor imaging you are currently doing. Thank you very much, and really appreciate your sharing your experience. So today, I think if there is no more questions or comments, I think we can end up today's session now and meet you maybe 2 weeks later for the last session of this semester. Thank you very much.
Yeah, thank you very much for your kind invitation. And if anyone has a question, you can contact me. And thank you. Yeah.
Thank you very much.